So basically, uh, generative AI is a subset of artificial intelligence focused on creating a new content or data based on learned patterns. So you might be aware about a different concept in artificial intelligence, and all the artificial intelligence concept will accept a different data from a already generated data source, data sets, and based on those data they will create some model, and that particular model will take a certain decision. Now in this way, generative AI is little bit different from a conventional AI concept. The reason is it will create a new content and data based on learned pattern. So if we can like format a path, you will have some data, and based on those data you can find a different pattern with the help of AI. Now whatever the patterns you have and whatever the content you have, based on those data as well as pattern, a generative AI will help us to create a new data from already generated data as well as pattern. So definitely it can rapidly transform the healthcare and pharmaceutical industry. The reason is sometimes whenever we need to find out a new drugs or a new medical treatment for some kind of cancer or some kind of like tumor which doesn't have a standard pattern within, like we have like fight against a coronavirus, and that virus is not a usual pattern. So basically at that time you will not have some standard data. Based on those data you can have different patterns. So at that time a generative AI can help us to create a new drug based on all the existing data, and a drug from a similar kind of like cancer or any other uh, like operation. So basically it's the ability to analyze a complex data set and generative innovative solution to help address different challenges like drug discovery, patient care, and operational efficiency. The main benefits of it can generate a realistic data. So like you might have some confusion that if it generates a new data, then what kind of data will be. So basically, the new generated data will be based on a certain pattern. So you don't need to worry about like whether those newly generated data will have a similar kind of characteristic or the attributes which should have if we have a realistic data. So definitely these data are generated by the AI, but it is as close as possible to realistic data. And definitely we can use a different learning models. We can use the extensive care of a different creative and technical industry. So now I would like to focus on healthcare first of all. So basically, a generative AI can be used for a medical imaging, diagnostics, personalized medicine, virtual health assistant, and predictive healthcare. So we'll take all this topic one by one. So the first one is medical imaging and diagnosis. So let's say in a conventional way, whenever you are going to some hospitals, at that time, the doctors might ask you to take some CT scans or X-rays, and based on those medical reports, uh, X-rays and CT scans, they are able to prescribe certain medicines to all the patients. Now, with the help of generative AI, like we have a different models like GN, generative adversarial network, or variations autoencoders. So, with the help of this kind of AI models, medical imaging can be used to generate a synthesized images. Definitely, it can enhance the image quality and early detection of disease. Sometimes, what happens that if a patient is in a stage 1 of cancer, or like some tumors have been like diagnosed within a certain CT scans or X-ray, at that times doctors may not able to diagnose those kind of disease in a early stage. The reason is the tumor is not developed up to a certain level. But with the help of this generative AI model, you may have an enhanced image quality, and with the help of those image quality, we can detect those kind of disease in a early stage. So definitely, if we can like detect those kind of disease in an early stage, then care we can cure those patients. And definitely the cancer or those tumor, when it goes to certain stage like stage 3 or stage 4, at that time it is not easy to cure those patients, and majority patient has to lose a certain part of a body, or they may die due to those kind of diseases. So if we can detect certain diseases in early stage, then definitely uh, we can cure those patients without losing their lives or a certain part of their body. The second one is personalized medicine. So nowadays, most of the doctors are like giving a personalized treatment plan for a different kind of patients according to their needs. Let's take an example. If a particular patient needs to give a certain medicine, and if that patient have a certain different kind of like disease within that body, and we cannot prescribe a certain medicine to them due to those kind of limitations. I will give you some certain examples that you might have idea about so many medicines and the drugs which are given to different patients in this treatment of coronavirus, that they might have faced with a certain side effect due to those drugs. The reason is they might have diabetes or a certain like lung disease, and with those kind of lung disease or a diabetic, the reaction of those drugs will be in certain different ways. So whatever the positive impact should be on a patient's body with the help of those drugs, they do not have the actual impact of those drugs, right? So after that, the mostly doctors are trying to give some treatment based on a nature of a patient's body. So with the help of generative AI, you may capture a patient's past data like a genetics, a medical history, and based on those medical history and genetics, you can prescribe a certain medicines to a certain patients. Like if they have a diabetic in like a genetics, or they might have like medical history with those kind of things, then you can prescribe a certain different medicine, so that patient will have a better impact of like whatever the medicines you have prescribed. Definitely, you can predict a treatment with a more efficiency if you have like early detection of some disease. Virtual health assistant. So majority we have like lack of doctors at sometimes, and like whenever you may need some emergency health, some emergency need of a doctor at that time, if you are in some remote location, or if you are on some vacation, you are not at in your home country, you might need to visit some private healthcare in those like foreign nations, and definitely it's very costly. Moreover, you may not get a proper response. The reason is those doctors your uh, doesn't have the knowledge about your medical background. So, like what type of drug is more suitable to you, that they cannot diagnose. So we might go for some AI powered chatbots like the telemedicine, or some automated generate response due to certain symptoms or a query. So we can call our like a hospital in our like hometown, and like to our family doctor, so that they may uh, like give us a certain medicine with the help of telemedicine, or like AI powered chatbots. So those kind of things can be possible with the help of generative AI. And definitely remote patient monitoring can be possible with the help of AI generate. Like let's say if some person have like some stroke or some heart disease, and if the particular doctor is not available in the clinic, or maybe a patient is not available within the town. So at that time, uh, the real-time health updates and the alert to like doctors as well as patients can be possible with the help of remote patient monitoring. And this kind of system can be generated with the help of generative AI. If you can have a like enhanced image which will help you to identify a certain disease in some early stages, then definitely it will help you in a predictive healthcare. So basically, disease outbreak prediction can be possible with the AI models, and a chronicle disease management can be possible with the help of AI, generative AI. So basically, generative AI will help us to monitor and predict a disease progression such as diabetic, hypertension, like how this diabetic will be grown in next 6 months or 12 months. Like let's say if you can identify this hypertension or diabetic kind of like problems in early 40s, then definitely you can treat those patients with a certain care. You can give some personal treatment plan to them so that those kind of diseases can't grow for like a next level. The best example is Path AI. So basically, if we need to understand AI in medical imaging, this particular example is a very good. Path AI is a leading company in applying AI to pathology, specializing in developing AI-powered diagnostics tool for medical imaging. So whenever you have certain X-ray or some CT scans, you this particular company will helpful to you to analyze those things. Based on a CT scan, MRIs, and X-rays, they will try to analyze a certain medical images so that with the help of Path AI technology, you will have you can like doctor can have the assistant in diagnosis disease, including various types of cancer. So like let's say if like the cancer cells have tried to produce within a certain body at that time, if you have a CT scans or X-ray or MRIs of those patients, and like with the help of this generative AI techniques like deep learning, Path AI will try to enhance those images, medical images, and definitely they can give a certain hint that a cancer cells are trying to develop in the patient's body. And if doctor have this kind of knowledge, definitely they can cure a patient in an early stage. So the main application of Path AI is pathology image analysis. So it can analyze a different image, a CT scan, X-ray, and definitely it can automate some tumor detection. And like definitely all tumors are not leading to a cancer, so definitely it will, if it has detected some tumor, then it will go for some quantification, some analysis on those tumor, and they will analyze this tumor cells, and based on this tumor cells they can provide some real-time diagnosis that whether this particular tumor may lead to a cancer or it's not a too serious problem within a patient. So the one very known example that Path AI has partnered with Mayo Clinic to improve the accuracy of breast cancer diagnosis. So definitely, so many female have a problem with this kind of cancer, and they may lose, they may have serious health issues and serious like problems with breast cancer. So if you can develop a tumor whenever it's in a growing phase, and so definitely certain deep learning models will train on 1,000 breast cancer pathology slides to identify early signs of disease. And if we can detect early signs, then definitely the like we there is a less chance of false negative. The reason is whenever you are trying to detect those kind of cancers in early stage, definitely you can treat those cells with a higher degree of accuracy. So Mayo Clinic is like they have tried to capture a technology developed by Path AI, and they have created certain tools and technology for the accurate detection of breast cancer. And definitely they will provide like a personalized treatment plan to all the patients, and based on like a level of development of this particular cancer. The main advantage of the accuracy, definitely sometimes even though you have those kind of CT scans and doctors can have like idea about this kind of tumor may lead to a cancer, but the chances of false negative are high if we are going for some manual detection. And if those detections are based on certain technology, then definitely we can trust on those technology, and definitely it will reduce a human error. The second thing is faster diagnosis with the help of AI's ability to process and analyze image quickly. A patient will receive a faster diagnosis, which is crucial for certain conditions like a cancer. Definitely, a Path AI's platform can scale to analyze thousands of images across hospitals and clinics. So let's say if a particular model is trained for one kind of cancers, we can extend the same concept for another kind of cancers. Like let's say you have created a certain diagnosis plan for a breast cancer, then definitely with the help of those diagnosis tool, we can develop another tool for a lung cancer or any other type of cancer. And definitely it will be a cost effective approach. The reason is it will reduce time, the efforts. You may not need to take certain medical images again and again. So definitely it's a burden on all like patients that they need to produce a different CT scans, a different X-rays periodically to analyze a growth of this cancer cells. So with the help of generative AI, you may have the idea about like after 15 days or after like 3 months, like how this tumor or a cancer will be enhanced. So based on those like growth of this cancer cells, you can give a certain treatment to a patient. Now we'll see about a pharmaceutical industry. Definitely, like if we need to produce a certain drug, we have a systematic approach, and all the pharmaceutical pharmacy people will follow those technology. But if we can merge it with AI, then definitely we can automate certain process. Definitely, they will have a core knowledge about how these drugs can be discovered, but they all those like procedures will be a manual, and definitely it has a certain chance of a human error. But if we are using a generative AI, then definitely drug discovery, clinical trials can be much faster compared to a manual process, and definitely we can improve a manufacturing and supply chain. So now we'll see all these process. So basically, with related to the first part, that is drug discovery and development, sometimes we have a conventional data about a certain disease. So at that time, pharmaceutical industry can easily develop a new drug, but definitely those process is a time consuming. Now let's assume if a new kind of like threat have been, like new kind of cancer have been identified in uh, like human being, and at that time, if we do not have a conventional data about those like cancer or any other kind of disease, then it is really hard to find a new drug. Like when this coronavirus have been identified in a human body, at that time we don't have any kind of drugs, any kind of proper treatment for the patient. At that time, we have lost so many human beings due to improper treatment. Now let's say at that time, if we have this kind of technology with us, and if the pharmaceutical industry have adopted those technology before evolution of that pandemic, then we may have a different situation in the like in our society. So with the help of AI, we can generate a certain data, certain images based on a similar kind of disease. So definitely a repurpose of existing drugs can be possible. Let's say we, like most of the doctors have prescribed a certain paracetamol uh, in a early phase to like reduce the effect of coronavirus in the pandemic era. Definitely that drug is not suitable for a coronavirus, but still patients are able to survive for like certain days, and by that time the effect of this coronavirus have been reduced. So definitely we can save like lives of so many people. Now if we have this AI based technology, then we can easily identify a similar kind of drugs which can be helpful in certain scenario. So now it will save a significant amount of time and resources compared to finding out a new drug from a scratch. And definitely you will have some simulated drug target interaction, like how this drug will react on a patient's body. You will have some biological targets. You can predict their effectiveness. You will reduce a need of some lab testing. So you can skip some of the processes with the help of this generative AI. The second one is clinical trial optimization. Definitely a synthetic data generations, patient recruitment and trial simulations can be much easier with the help of generative AI. Like let's say if you are trying to find out a drug for a certain disease, then if you have stored data of different patients, then you can call those patients with this electronic health records and other data sources, and the identification of different patients will be much easier whenever you are trying to take a trials of this newly found drugs. So let's say if you are trying to find out a drug for like a breast cancer, then if you have the data stored of different patients, and with the help of those data, you can easily find out different females who have this kind of uh, like disease, and if they are agree, definitely you can consider them for your clinical trials. So that, and definitely with the help of AI you can simulate some of the process. So like let's say if you have higher chances of failure with some certain drugs, then with like, and if you are applying those drugs on some animals or on some human beings, then definitely uh, they might lose their lives, or they may have some like a negative reaction on their body. So if we can simulate those process, then it will be a much better for life of humans as well as animals. After discovery of drug, definitely if you have a certain like models based on the whatever the process you have followed, then definitely you can improve the like processing time, you can reduce the waste, and definitely the quality can be much better compared to a manual production of different drugs. So once you have identified a correct formula for a certain drugs, then we can use the generative AI model to automate the drug manufacturing process and the supply chain process. So with the help of those things, we can have a better like outcome. And definitely we can predict a demand, and based on the demand we can like adjust supply chain logistic. We can manage the logistic activity much easier. Like let's say if there is a prediction based on a certain uh, like a weather condition, like generally in a winter a certain type of diseases, there are a more threat of certain type of diseases. During monsoons we have uh, like certain diseases are most common in all the people. Like if you can predict those kind of stuff, then definitely you can increase manufacturing of those kind of drugs. So whenever you have a more demand of a certain drugs, you can fulfill those demands. Definitely, in all the countries, we have different rules and regulations of different drugs. Like certain drugs are not permitted in certain countries. and they might ask for certain type of clinical trial reports. And now if you want to export those drugs in a certain countries, and if you have some automated system, so you can produce a certain type of clinical trials which will satisfy a requirement of a particular country. Like let's say if you are trying to export certain medicines into a UK or in a USA, they have a different kind of uh, like a requirement, medical requirement, and you need to fulfill all those requirements if you want to export a certain medicines into those kind of countries. You can provide some real world evidence based on this generative AI process, like how this drug will react on a body of a human being. The most common example is IBM Watson, the AI-driven drugs discovery. It's a very powerful AI tool which helps a pharmaceutical companies to accelerate a process of drug discovery, and by leverages vast amount of biomedical literature, clinical trial data, molecular data. This IBM Watson is using AI to identify potential drug candidate more efficiently than a conventional method. So definitely there are a certain conventional method and you can find out a potential drug candidate, but with the help of IBM Watson, you can identify a candidate in a much easy way, and perfect matching can be possible according to your like requirement of clinical trial with a potential drug candidate. And definitely a AI platform can analyze and extract insight from a scientific literature, data sets, and clinical data. So you can trust those procedures because they have a background knowledge about uh, certain disease with the help of data sets. The main applications of drug discoveries, it will help us to identify potential drug target, drug repurpose. You can reproduce a certain drug for a new kind of threat. Let's say conventionally paracetamol is for a cure of some like a different kind of disease, but we have used a same drug for a coronavirus, right? So with the help of generative AI, you can propose a certain alternative drugs which may have a partial effect on a newly developed disease. A molecular design and optimization can be found with the help of this kind of drug discovery mechanism, and definitely a prediction will be much easier whenever you are trying to find out a new drug. The best example is in with the collaboration of Pfizer, IBM Watson have applied different cancer treatment research, particularly for a lung cancer. So, with the help of IBM Watson, they have developed like a treatment plan for a lung cancer. Watson have analyzed a millions of different clinical trials. So definitely this process will take years or decades to find out some fruitful output. And by that time, the like the severity of those disease will be increased a lot. So with the help of IBM Watson, you can analyze those clinical trial records with the help of some scientific papers, some scientific processes, uh, to finding out a new drug, which will be a much easier. And you will have a data of different patients. So with the help of those data, you can find out different patients on which you can go for some clinical trials. So with this approach, it's allowed to go for a rapid identification of some promising molecules which will lead to lung cancer. And Watson have helped a researcher to undiscover new pathways for drug discovery, which might have been missed using traditional methods. So different traditional methods, they will work in some conventional way, but whenever you are trying to find out a certain new drug, whenever you are trying to cure a new disease, at that time you will need to think out of the box. The main advantage is the AI can analyze a massive amount of data in a few hours only, which will take a certain years whenever you want to do it in a manual way. And definitely it will reduce a cost, because there is a cost associated with this kind of system for one time. Whenever you have already developed this particular system, you can reuse this system again and again, uh, with for a new set of clinical trial. So it will reduce a cost of drug development, and all the patients will have different drugs at some cheaper level, in with some cheaper cost. The precision, definitely, this AI models work in a more accurate way. So the researcher can narrow down a drug candidate with a high likelihood of success, and definitely it will improve success rates in clinical trials. Now, I would like to tell about how this generative AI can be applied to a public healthcare system. For understanding this purpose, I will like to talk about National Health Services in the UK. So basically, within UK, we have a, like a National Health Services, and the NHS is NHS in the UK has been the forefront of adopting AI technologies. The reason is the all the uh, people living in the UK, they are using this kind of services, and with the help of different technical companies and academic institute, NHS has developed automated healthcare system. With the help of those system, different patients like can be suggested with some common treatment in certain conditions, and definitely clinical decision making and patient's care can be improved a lot. Uh, the reason is they have a very shortage of NHS staff, and like they don't have sufficient like doctors and staff. And with the help of this automated system, you can provide a treatment to like so many peoples with a less amount of staff. The integration of AI into NHS system has led to a significant improvement in diagnosis. Treatment planning is possible. Patient flow management is possible. The reason is we like in the UK, you have a diversity of different people. So many peoples are migrated from a different country. So definitely they will have a different medical history. They will have a different genetics, and a same treatment cannot be possible for a different kind of people. So definitely they should adapt certain different things so that a personalized treatment plan can be possible. Now, how this happened, let's understand with different scenarios. So, so the main application of generative AI in the NHS, the first one is predictive diagnosis and early disease detection. Now, I would like to refer to a certain paper in which the process have been formulated. So basically, NHS have been partnered with Babylon Health, which will use a different generative AI model to analyze a patient's symptoms and provide an initial consultation based on historical data. Now, if I need to summarize this process, like whenever you want to like communicate with a doctor or some medical staff, at that time they have some like a chatbot kind of system. You need to call on that particular number, and whenever you are trying to call on that number, they will start with a certain set of questions. So definitely based on your answer, they will ask you a certain questions. Like let's take an example, like they will ask you about certain like kind of symptoms what you have. Like let's say you have asked that I have a headache, I have a fever, I have a body pain. So based on whatever the symptoms you have suggested, they will narrow down to a certain type of disease. So definitely, with the help of generative AI, they are trying to diagnose based on a certain symptoms. And NHS have developed this kind of system with the help of Babylon Health, and it will reduce a time. Like, let's say if you are, I will give a difference between using a generative AI and without using a generative AI. Let's say if you are trying to identify a certain like disease without generative AI, then definitely a doctor will ask like what kind of symptoms you have. Like, you will provide all the characteristic of different symptoms to the doctor, and based on a knowledge of a doctor, definitely they will try to provide you a certain medicines. Now if you are going to some like a general surgeon, definitely they will have a very good knowledge about those kind of like disease. But if you have chosen a wrong, like a specialized doctor, then definitely you might lead to a wrong kind of disease. And sometimes that doctor may need to refer to another doctor. Like once the doctor have identified that whatever the symptoms you have, a different doctor can provide you better treatment. So now you will go to another doctor, and definitely you will need to explain all those stuff to the second doctor. And this particular process will delay a treatment, uh, delay appropriate treatment. Now, if you have certain automated system, then definitely based on answer what you have provided, this automated system will suggest you a certain hospital or a certain doctor which can provide you a much efficient treatment plan, a much personalized treatment plan. So that is the main benefit of using this generative AI in a public healthcare. Now, with regard to a second like application, that is personalized treatment plan, the NHS have you collaborated with a Google DeepMind. So with this collaboration, with this partnership, NHS is using AI's different treatment plan for the patient with like certain eye disease. Like let's say if you are trying to provide your the photo of your eyes, like if you have some certain eye disease, then based on this medical image, they can suggest you a certain personalized treatment plan. Similarly, if you are providing x-ray or a CT scan, based on those medical images, they can provide you a personalized treatment plan. So with the help of DeepMind, NHS is trying to provide a personalized treatment plan based on a certain photo, based on a certain medical imagery, a radiology documents, a radiology image, a chest x-ray, so that, like let's say if you have some symptoms of lung cancer, and with the help of chest x-ray, the diagnosis of those kind of diseases can be possible in an early stage. So with the help of DeepMind, NHS have developed a certain system with the help of generative AI, with the concept of generative AI, so that they will have the much early detection in a less time with accurate result. So that is a main usage of this generative AI. Now, the most crucial thing, like if you have like some relatives, some friends who are living in the UK, it's a most frustrating thing to uh, take appointment of doctor. So they need to manage a flow of patient. They need to manage different resources in some optimized way, so that they can utilize a different healthcare infrastructure in a more appropriate way. So NHS is using a AI powered tool to optimize a patient flow. Like let's say the working hour of a particular doctor is 9 to 5, and definitely within this 8 hour of time, they can like book an appointment for like let's say a 7 or 8 different patients, or maybe a 10 different patients. So all the doctors will have a certain amount of like vacancy per day with all the patients. And now once a treatment of a particular patient has been started with a certain doctor, then definitely the remaining treatment of a particular patient should be go in a certain flow. And let's say if a particular doctor is not available in the next week, and so it may lead to a delay of that treatment. Now with this like patient flow system, whenever you will meet to a certain doctor, they will put all the data of yourself within that system. So even though you are not meeting to a same doctor, a new doctor or uh, the, the next doctor will have an idea about all your previous treatment, all your previous symptoms, and based on the like new symptoms, or like whatever the improvement you have in your like health condition, or if your health condition is now in a severe phase, so they can change treatment plan. So if the particular treatment plan is working fine for you, definitely they will follow the same treatment plan. But if a particular treatment plan is not suitable for you, then definitely they will go for like a new like a x-ray or some blood test, and based on this additional data, they can give you a more accurate treatment plan. The next one is automated health monitoring and virtual consultation. So sometimes what happened that it's not easy to go to the hospital if you are not available in the same city, you are on some vacation, you are in some different city due to the change of job or a transfer. At that time, uh, if you can book a virtual consultation with your family doctor, then it will be a much better idea. A doctor can monitor all the improvement of your health, all the changes within your body easily. So the NHS 111 is a telephone service. With the help of this telephone services, they can try to consult a different patients in a virtual way. So you can directly talk with the doctors. They will ask you certain questions, and based on those questions, they will suggest you a certain like drugs. Now, if they feel that you should consult a doctor, you should visit a hospital, they will like suggest you to visit a certain hospital based on like whatever the symptoms you have. So in this way, you can automate like different processes with the help of generative AI. So this is a very good example, I would like to say, for a public healthcare. So definitely we even in India, we have so many good hospitals, but if we can manage all those hospitals, all those doctors with this kind of concept, then definitely we will have a better picture about healthcare industry. The like the landscape of healthcare industry will be rapidly changed. So many people can consult with a specialized doctor. Like let's say we have this AIMS hospitals in certain cities, and like what about other cities? Like if you belongs to a certain remote locations where you don't have very good government hospitals or the AIMS kind of infrastructure, then definitely you will need to suffer uh, due to lack of this appropriate medical treatments. But with the help of this generative AI, you can create some automated system with the help of different expert doctors and medical staff, so that it can reach to some common people. So that is the main motive of this generative AI. Definitely, generative AI cannot replace any medical staff, any doctors, but this technology can reach to a common people with the help of those experts. So definitely all the doctors, all the medical staff doesn't have the sufficient knowledge about all kind of diseases. So like whatever the knowledge they have, whatever the specialization they have, you can use those specialization and create some system with the help of like a technological advancement was similar to this kind of system within our country to like provide accurate treatment to all the common people. So, like on a summary, the NHS is using a generative AI to demonstrate how AI can revolutionary change the healthcare delivery process in a public healthcare system. So it's not like that it's a very costly or like only private hospitals can afford those kind of things. It is more beneficial for a public healthcare system. So from a predictive diagnosis to a personalized treatment plans and operational optimization, NHS is trying to make a stride in enhancing a quality of care, improving efficiency, reducing a strain on healthcare professionals. So definitely doctors will have their like a personal life. They can enjoy a certain holidays, and definitely like patients don't need to suffer due to the unavailability of certain doctors. So it's like beneficial for like a medical staff as well as for other people. So through a collaborative approach with different companies like DeepMind and Babylon Health, NHS is trying to explore a new ways to harness AI to improve patients' outcome as well as healthcare services. So you can improve the healthcare services, and definitely all the patients will have a benefit of this improved services. They will have early detection of certain like disease, and generative AI, particularly in medical imaging, will be used to predict certain healthcare conditions. They will provide you personalized medicines, and definitely it will reshape a landscape of healthcare in the UK. So similarly, it's a blueprint for a public healthcare system. We can go with a similar kind of approach whenever we are trying to improve a certain healthcare services. So now I would like to conclude. Now I'm open to like communicate with academician and researcher, like if they want to know something more about this applications.
Hello. Yes. Thank you, sir. It was a wonderful session. Myself, Matrix, I'm assistant professor at LD College of Engineering. Actually, we have total 450 participants who have joined this meeting,
Okay,
and
good.
we have created this meeting using town hall mode of Microsoft Teams.
Okay,
Now, which does not allow participants to directly chat. So we have created one WhatsApp group. So
okay,
now we are opening that group for questions, and if any
okay.
question comes, I will ask that question on behalf of the participant.
Sure,
Just
sure.
a second.
Uh, Maitreyi sir, I want to add something. Hello.
Yes, sir. Yes, sir. Please.
Yeah.
We have time. Yes, sir.
Yes, yes. So in the meantime, I would also ask Harshil sir to brief about the engineering education system in London, specifically his college, the way they run the graduate engineering programs, their PG admission.